Hi, my name is Kate and welcome to my channel. Today I continue the conversation with Rachelle Garcia Seliga, who is a midwife and also an author, a trainer of innate postpartum care certification program.
Let's imagine there is someone who is a first-time mother, and what is their untold truth about birth that nobody tells you, or people never ask the advice they should ask potentially about this. So is there something that you really would like to share with someone who is a first-time future mom?
I feel that it's really important when choosing your care provider. Like if you are not going to have a free birth, if you're not planning to have an unassisted birth and you're choosing to have a care provider, to ask the care provider about their own birth experience. What was their experience being born into this world, and what was their experience giving birth? Because if they look at you like you're crazy and what does that have to do with me offering care to you? You know that they have a really big blind spot, okay? Because, and this might be far out weird for people to hear, right? If they're not tapped into the world of pre and perinatal psychology, but how we're born matters. How we're born imprints us for life. We carry all of that. And most women, men too, right? Most people who get into obstetrics or midwifery get into that work because we have our own wounds to heal. Okay, that's just the truth of all things, right? We teach what we need to learn. Like anybody who's doing any kind of profession that's offering care, whether it's therapy or massage work or whatever, it's because they have some kind of wound that they're working through to heal. And in and of itself, that's not the problem if the individual's doing the work. The problem is when those wounds are unconscious, as they are for most birth professionals. They have no idea that that even exists. They have no idea that they got into this work to heal their own selves. And so they bring this unhealed trauma with them to every birth they attend. And the anxiety or the fear or whatever it is they experience being born into this world as a baby, not in their conscious mind as an imprint, but in their body mind as an imprint, in whatever way they felt when they were giving birth, if they're women, all of that affects them. So their capacity to show up with you or not as a birthing woman in trust in you as a woman is completely dependent upon their relationship to their trust in their self and their own process. So to me, most problems, interventions, traumas that are happening at birth are happening because of the care providers. Okay. If I had to make up my own statistic, I would say 95% of birth interventions and traumas is because of the traumas undigested of the care provider themselves. So I would like to know, if I was going to have a birth care provider for myself at this point in time, what is your experience in that way? Are you even aware of that? Have you done healing work around that? And then I would like to know about their protocols and what kind of protocols are they upholding? Because even with midwives, most midwives are upholding legal or state protocols rather than biologically based protocols. So it's important to know that. It's important to know, in the United States, if a woman gets to 40 weeks, which is the due date, if she gets to 40 weeks in one day, it's like a danger, right? And there is no woman in a hospital in the United States that's going to get to 41 weeks because they will tell you it's an emergency and that you are putting your baby's life in danger and you need to have ultrasound every day to monitor. And if you're not going into labor by 40 weeks and 6 days, then you need to come in for an induction. And it's what is that based upon? That's not biological truth. Biological truth is that babies are born anywhere from 35 to 36 weeks of gestation to 44 weeks. How do I know that? Because babies' lungs are done developing in the womb by about 35 to 36 weeks. So then it's okay for them to be born, right? And 44 weeks, because I've known many women who have gone to 44 weeks gestation and give birth to normal, healthy, functioning babies and healthy placentas. It's not that your placenta starts to deteriorate when you're 40 weeks and 6 days, you know? So it's like this range of normal is really only what traditional, authentic midwives hold. So it's like, as a birth care provider, are you upholding biological reality, or are you upholding, you know, man-made, literally man-made, fabricated reality that's not based upon this design? You know, those are the things that I think are most important for women to ask their care providers. And then also it's like, how do you feel with this person? Like, you need to feel like you'd be totally good to get naked in front of this person and do weird things. You know, if you don't feel good with this person enough that you'd feel good to get naked and do weird things, they're not someone that you want to have around you when you're giving birth. Because you have to feel safe when you're giving birth, but not safe in this mental construct, safe in your body, you know, loved and nourished and witnessed, but not observed and monitored and controlled.